pathology. This is a case history or a video study of 37 years old female parents with a history of pelvic pain for the last few months. Now, what we are seeing here is that this is the urinary bladder in longitudinal section. Small amount of fluid is seen in the dependent region peritoneal cavity with bowel segments floating in it. In the magnified view, you will be able to appreciate it in a better way. Now this is all fluid. This is fluid in the dependent region peritoneal cavity. These are the bowels, and when I move the probe towards the uterus and try to align the uterus with vagina, what comes in front of us is, now you see that this is the pathology relating to this problem of this patient, the pelvic pain. Now she had a stitch from, as per her verbal history, she had a stitch from a local LHV to get to avoid any further conceptions. Did not help, so that she does not have any further babies. The interesting thing, we can only visualize that this is the vagina, this is the cervix, this is the cervical canal. Now this area is the cervix. This is the lower segment of the uterine cavity, uterus lower, and now this is the endometrial canal. Now from here we see a cystic area measuring approximately 20 by 20 millimeters with another cystic area at the fundal region. Now this cyst, it communicates, I'll show you, it communicates with this cystic area, with this cystic area. Now this is a cystic area in the fundal region of the uterus with the opening into this well demarcated thin wall cystic area with dependent region echoes. These are dependent region echoes, and you will see multiple septals in other view. So this is the anterior myometrium, this is the posterior myometrium, and this is the sort of a breach in the fundal region that communicates with the cyst that is seen anterior to the uterus. It's anterior to the uterus. So the fundal region is not clearly visualized, completely visualized rather, I should say, because of the reason I have just told you. Now here you see that this is this. Now this is the cystic area in the fundal region with echoes. This is not clear. This is the lower segment of the uterus. This is the cystic area, and there are echoes within it. And from here, this is the area where it communicates with this larger cyst seen anterior to the uterus. And now these are all septas. This is debris, and this is a thick wall cyst. So in this case, what we've seen is that there is a breach in the fundal region of the uterus that is full of internal echoes, and which opens into a larger cyst that is anterior to the uterus. This is the uterus, anterior to the uterus. Now this cystic area, this cyst contains dependent region, multiple septas, and debris as well. So this is a post-interventional problem. This is the transverse of the uterus, and this is again the longitudinal section of the uterus. Now let's study the cyst only. You can see that the posterior wall is strong. We are seeing strong back wall. You can see the septals, thick, thin, complete, incomplete, all sort of septals are present in it. This is the longitudinal section. Now this does not change its shape when I rotate the probe. And now I'm rotating the probe. It retains its shape, and all the material is seen in the dependent region of the this cystic area anterior to the uterus. And not only this, there is also small amount of fluid. Here we are in the dependent region, peritoneal cavity. Is there any pathology seen in the abdomen? Okay, now this is the kidney. There is no evidence of any fluid in the Morrison's pouch. This is the gallbladder, portal vein. This is the pancreas. This is for the para-aortic lymph nodes, aorta with superior mesenteric artery rising from it. Nothing wrong here. Now the spleen. Now this is the spleen, which is normal in size. 11.5 up to 12 is considered normal. This is the splenic vein, and this is the kidney, left kidney. There we are. So nothing wrong here. Any fluid in the paracolic gutter should be seen. In such cases, there is no fluid in the paracolic gutter on the left side, and there is no fluid in the paracolic gutter in the on the right side. And the only findings are that I have narrated to you repeatedly now, that there is a cystic area with a breach communicating with the larger cyst anterior to the uterus. There we are. This is fundal region cyst, this is the breach, this is the larger cyst anterior to the uterus, and there is small amount of fluid in the dependent region peritoneal cavity. This is the fluid. So this is our case of the day.